Dr. Rosevear, thanks very much for joining me today. So to start, have you been tested for the coronavirus, and have members of your staff been tested?
I have not been tested yet for the virus, but I've been lucky enough that I haven't displayed any of the symptoms yet. In Colorado Springs, where I live, getting testing is very challenging. Right now, it's limited to inpatients who are at high suspicion of having the disease. One of our staff members demonstrated some of the symptoms about 3 weeks ago, and I tried very hard to get her tested, and I was unable to do that, so she simply self-quarantined for the last 2 weeks. But as everyone knows, it's a challenge.
Absolutely. What is the current status of your practice?
We are up and open for business. As you well know, just because there's a terrible viral pandemic going on doesn't mean that urological disease stops. I'm on call today. I've already added on 2 stones, both of which need to go this evening because the patients are in significant pain. There's a lot of other medical problems that we deal with on a regular basis that are ongoing. I know there's variation. I do some outreach work in Alamosa, which is a small town in Colorado, and great town. I love the community, but they've taken a little different approach. They took the approach to shut down their clinics significantly to minimize exposure to their staff and to maximize the conservation of PPE and other gear. Unfortunately, that had the unintended consequence of having a lot of their patients who could have been dealt with in the clinic end up in the ER, urinary retention, people who think they have a UTI and just want to give a sample. So we've done the opposite approach. We have minimized our staff to a skeleton staff. We are doing 99% of our patient visits now by telemedicine, which is working out very well. But we are open, and if a patient thinks he's having problems, catheterization, we bring him into the clinic. Our population is very at high risk of this disease, and so anything we can do to keep them out of the emergency rooms is probably a good idea.
So you mentioned that you transitioned over, and you've been doing quite a few virtual visits. Could you describe how that transition has gone for your practice?
At first, it was a challenge. We didn't know what we were doing. We had looked at telemedicine in the past, again, because of some of our desire to do outreach clinic based on where we were, but the rules associated with that, the gear and the compensation just didn't work for us, so we decided not to do it. But now that CMS has loosened the rules, we're having a lot of success. We try hard to do things like Skype and FaceTime and Duo, which is the Google equivalent, so that we can talk to patients. But if we don't do that, the telephone works just fine. I think urology is very lucky because a lot of our visits are the story, as well as radiology. The physical exam, while important in some situations, can be avoided in a lot of situations. So we're able to do a lot of the stuff by telemedicine to continue to do good medicine.
How has the pandemic affected your performance of elective procedures?
Well, that's a tricky scenario. When this first started, we were told, it was recommended that everybody cut back on elective procedures, and there was a lot of debate about what defines elective procedures. In Colorado, Governor Polis, probably approximately 2 weeks ago, put out a mandate stating that elective procedures will be delayed, and he put down some very strict guidelines on what defines an elective procedure. Ever since he did that, we have cut back our procedures significantly. Things like nephrectomies. I recently did a nephrectomy for a very large kidney mass. That needed to go. We have a cystectomy next week. Those cases need to go. On the other hand, we haven't done a vasectomy in 2 weeks. I think our last time we looked at our list, it was over 40 or 50 patients who have had vasectomies or who have had the consult visit for a vasectomy, but we haven't booked them yet because we don't know when we're going to be able to do that. As of last night, the governor extended that ban until the end of this month. So it'll be at least end of April, early May before we start doing elective procedures again.
What are some best practices that you've picked up and implemented and that you could share with the community practice urologists in coping with the current situation?
This was tough. This was a lot of battlefield medicine, trying to figure out what works best for both our practice and our patients. And in the end, the model that we're using is that we have to balance a bunch of compromises. We have to look out for the safety of our staff. The safety of our staff and ourselves is very important. We have to look out for the safety of our patients. As we talked about, there are a lot of things that we can do in clinic for our patients that they need done. They need done urgently, and which we can safely do in clinic and keep them out of the emergency room, which is probably doing them a favor. And we also need to kind of watch out for the world. I mean, we have a social responsibility to do our part to maximize the conservation of PPE and to keep people out of the emergency room. But we also have a business to run. And so we need to figure out some way to maintain revenue going forward. And so compromising on those 4 goals has been challenging. For us, we have reduced our staff down to a skeleton staff. We are able to have a lot of our staff work from home to reschedule patients as well as to schedule our televisits. We have a staff working from home to monitor our elective procedures. So when patients call, we can give them rough ideas of when we can schedule those. At the same time, we're keeping staff here in the clinic to keep it open for the emergencies. And we're still seeing call though. And we're still doing call and we're still operating when we have to. So it's a compromise.
What are you and your practice doing to look out for each other and, boost each other's morale during this time?
One of our practice managers, Jeff Moody, recently wrote a book about the kind of the burnout crisis, and I've read that book. We have twice weekly Zoom meetings. We've all become very familiar with Zoom, where we kind of get together and we talk. We are still having at least 1 or 2 guys in the clinic every day, and that's nice. We have the call guy, and then usually 1 other person, so that gives us some opportunity to have a little social talking. We keep our distance, but you can at least talk and go from there. But it's kind of tough because these are my partners, are the guys I go and have a beer with. They're the guys we go out and we do stuff, and we haven't been able to do that. So like a lot of people, the pandemic is putting a lot more stress on us. But we'll push through this. I'm confident that at the end of the day, everyone will look back and hopefully be proud of what they accomplished and how they behaved during the crisis.